Finishing off the personal training section, if I had a member come up to me that wanted to do a fitness program that only took them 20 minutes and they want to do it Monday through Friday, I would design a circuit training program with them. It would entail 3 to 5 minutes of cardio with strength training in between those 3 to 5 minutes. Day 1 would be upper body, day 2 would be lower body. This would allow them to see some weight loss, some cardiovascular endurance, as well as some strength gains. And they will be able to achieve their goals in that 20 minutes of time. Moving on to the postural abnormalities. In picture 1, this person is a flat-footed person. They should feel some discomfort probably in their feet. After an analysis, I would encourage them to do some barefoot work, walking on their toes, working with some towel. Do as much walking in their bare feet to help strengthen the ligaments and tendons in their feet, as well as help strengthen the arch. I would also encourage a flexibility program that would help loosen up the outer portion of their calf, the peroneus muscles, that would need some releasing, that would help prevent the rolling in of the ankles. In picture 2 is a kyphosis or a sway back. These people have a tendency to have some pain in their back as well as their hamstrings, which means they have some tight hamstrings, as well as weak hip flexors. I would encourage this person to do a flexibility as well as Pilates program. With the Pilates program, it gives them posture awareness, helps reduce the kyphosis in their back, the lordosis in their back, as well as help strengthen up the hamstrings and hip flexors, as well as their obliques. So that way the lordosis and the sway back becomes less from a Pilates program. In picture 3, this person's neck is slightly forward, which means they have some weakness in their neck flexors. So what that would do, I would encourage them to do, is to strengthen their upper back, as well as incorporate a Pilates program that would help do cervical nods, as well as cervical lengthening, will help strengthen the flexors in their neck. The upper back will help pull back their shoulders, as well as encourage them to do a flexibility program to help release the pectoral muscles in the front. Moving on to your general questions. If I had a member email me about a specific machine in the fitness center, I would email this person back, let them know what time I'll be at the gym, what works for them to come in, and we can set up a time so they can go through the machine physically, and if they have any questions they can ask and I can answer them right there. If I had overheard a group of people in the weight room dropping weights and having inappropriate comments, I would go up to those people, professionally talk to them, let them know that the fitness center is meant for everybody, not just those 5 or 6 people, and to please refrain from those type of comments within the fitness center, as well as letting them know by dropping the weights. It actually breaks the weights down, especially when they're using the dumbbells, and it is not appropriate, so please refrain from dropping it, because if they can lift it, they can place the weights down. If I had overheard 2 people in the fitness center discussing a piece of equipment, I would listen to the discussion to make sure that they were telling each other correctly what the machine does. If there is any discussion that does not tell us what the machine is actually doing, I would have no problem going into talking to those people, letting them know that this is how the machine works. If they have any questions, let me get on it, demonstrate it for them. Policy in the fitness center, I would encourage people to follow the policy. If somebody's in the gym and they're not working out in sneakers, I would professionally and kindly go up to them and let them know that they are required to wear sneakers because of safety. If they do not have a pair at their office or in the locker, they're going to have to bring them the next time they come in. They cannot work out today, unfortunately. What I would like you to take away from this video is that I am first and foremost a professional. I like to keep myself well informed in the latest programming in the fitness industry. That way I can provide the best training to the members at any given time. And I would like to thank you in advance for your time. Thanks.